talking to friends more and texting less? Have you noticed you aren't as lonely as you thought you'd be? Or that your kids have new superheroes? And so do you? Have you noticed that walls can't stop love? When all of this is over, and it will be, don't forget about the things you've noticed. WCCO, always.
In your community, there are businesses ready to help you through this difficult time. From restaurant takeout, appliance repair, roofing, or AC services, BBB connects you with local, trustworthy companies ready to do business safely and ethically. Support your local economy. BBB, building trust in trying times.
There's a whole galaxy out there. Let's go. Fascinating. Do you know? CEO. Good afternoon. We're breaking into programming for the Department of Health daily COVID-19 briefing. So let's go ahead and listen in.
Well, thank you. I would now like to hand the conference over to your host, Mr. Mike Shulmers. Please go ahead, sir.
Thank you, operator, and thank you to everyone for joining us for the COVID-19 daily media call for June 15th. Governor Walz is not on today's call. We'll start with the situation report from Minnesota Department of Health Commissioner Jan Malcolm. Following Commissioner Malcolm, we'll get an update from Infectious Disease Director Chris Ersman. And after those updates, we'll open it up for questions. With that, I'll now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. At the global level, as of early this morning, the world was above 7.9 million cases and almost 434,000 deaths from COVID-19. In the United States, as of this morning, we had more than 2 million cases and just over 115,000 deaths. Here in Minnesota, we are announcing today a new total of 30,693 cases. That was based on 230 additional cases confirmed yesterday on Sunday, following Saturday's increased cases of 303. That represents, today's number represents the third day of decline after 3 days of increases that we saw last week. So that pattern that we've talked about a couple of times did reemerge again in recent days. Notably, the last time we had case growth this low was April 26th, when we had 214 cases, and that was on a volume of 2,200 tests. The 230 cases that were confirmed yesterday was on a testing volume of just over 5,000 tests. I do want to mention here, though, that we just became aware this morning that there was a computer problem in the test reporting coming in. So the actual number of tests performed yesterday was quite a bit higher than the 5,000 that I just mentioned. And so we do expect that we don't know this for sure, but we believe it's likely that in those additional tests, there will be additional positive cases as well. So don't be too surprised if we announce a corrected number tomorrow. We also are announcing today an additional 6 deaths that were confirmed yesterday, bringing our total now to 1,304 deaths in Minnesota. The last time we had fewer than 6 deaths was April 12th. This total of deaths from yesterday includes 2 persons in their 80s, 2 in their 70s, and 2 in their 60s. This was 4 people in Hennepin County and 2 in Anoka County. 4 of these deaths occurred in residents of congregate care facilities. There are currently 353 patients currently in the hospital, 186 of those in intensive care. We continue to see hospitalizations and ICU bed use specifically from COVID declining. COVID-related hospitalizations have declined for 6 days. ICU use has declined or been stable for 4 days. So So this is also an encouraging sign of stability, although I will note, and you will see on our various public-facing dashboards that hospital capacity overall still is running fairly high, but that reflects all hospitalizations, not just those related to COVID. I would also just like to say another word about testing. We have noted that the importance of the test positivity rate as one of our really critical metrics that we are looking at. The 7-day rolling average on the test positivity rate is 3.5%. It's dropped each day from a level of 4.3% a week ago. So the test positivity rate is also heading in the right direction. With respect to the community testing that happened last week and will continue in the couple of weeks to come, there were 3,200 people tested over Tuesday and Wednesday of last week at the 4 community-based sites. Mayo processed all of those sample results. And the case positivity rate among those 3,200 people was 1.8% positive. In addition, Health Partners reports that they have tested 8,500 asymptomatic people through their expanded testing sites that they have opened up, including walk-in and drive-through sites as well. And which we really appreciate Health Partners stepping up and expanding capacity to that degree. So they report that they've tested, as I said, 8,500 asymptomatic people who had participated in mass gatherings, and Health Partners has found that effectively a 1% positivity rate. So those numbers also are encouraging in terms of the positivity rates that we're seeing so far from the mass gathering testing. Community testing events will continue this week. People on the waiting list from last week will be notified first of the availability before testing appointments are opened up to the broader public. And certainly we know that some folks who were not able to be tested last week may have gotten testing elsewhere between then and now. But again, we are encouraging folks to take good advantage of this expanded testing that has been made available. With that, I will turn it over to Chris Haberson.
Thank you, Commissioner. Last Friday, we had mentioned new guidance that was coming up regarding window visits at long-term care facilities. That guidance is now available in the guidance library on the MDH COVID webpage. The guidance provides details on how people can minimize transmission risk while still finding ways to connect socially with loved ones in long-term care. Restrictions on visiting indoors are still in place for the time being, given the ongoing risk of COVID-19 for this higher risk group. It's important for facilities to work with residents and visitors to allow window visits and to make sure that they are safe and that rules are followed. Our guidance really emphasizes the importance of contacting facility staff before a planned visit so they can have your loved one best ready and at the window at the time of your visit. We also recommend making sure a phone is available if one is needed for the resident to speak to you from a safe distance. During these visits, we want to make sure people are still observing social distance guidelines and wearing cloth masks as an important additional protective step. As we mentioned Friday, connecting with loved ones in long-term care is important for the health and well-being of them and us, and our goal must be to do it in a way that doesn't put them at greater risk from COVID. Please visit our website to review the guidance that is posted and contact your loved one's facility to discuss details as you plan your visit. Additionally, the Department of Health is in coordinated conversations with provider groups and advocates throughout this week so that we can develop recommendations and guidance on further visiting options.
Well, hi, everyone. As you can tell, the audio is really scratchy and sloppy on that call. We don't know if it's the service that's hosting the web call or coming from our end, but we do know it's difficult to hear. So if you'd like to continue listening, you can switch right now to CBSN Minnesota. That's our free digital channel. You can access that through WCCO.com or on any device by downloading the CBS News app. And then when it comes to the actual call, we'll make sure that we see what the highlights are in terms of policy, in terms of number, and bring those numbers at 5 and 6. So sorry about the audio quality today. Thanks for tuning in, and we'll see you on the news at 5 o'clock.
To do with the other states seeing, like Arizona, parts of Texas, seeing case growth, not just in cases, but in hospitalizations as well. I guess I'm wondering how you view that. Do you view that as kind of there, but the grace of God go I kind of thing, that Minnesota might have avoided that? Or is that like a mirror into our future, and then this is what we should see coming next? I'm just wondering how you view what's happening in other states as a lens for Minnesota.
Jeremy, this is Chris Earsman. I think that it's a little bit of both, actually. Our hope is that we may somehow be spared, but we need to recognize, as we said on prior calls, that much of our opening up has happened, since June 1st. And so we need to allow a certain amount of time even just to get through an incubation period. So for instance, for the opening up that occurred on June 1st, just yesterday we would have reached the 14 days that constitutes a full incubation period. And so to allow people time to maybe develop symptoms and get tested, it takes a little while for us to be able to assess where we're at completely. Having said that, we're delighted that our numbers are lower, albeit with the glitch with the testing. But we're pleased when we have lower numbers. We're pleased that our healthcare system has a chance to breathe and catch up. But I think it's too early for us to look upon Texas and Arizona and say, oh, we dodged that bullet. I think it's too soon for that, but we're certainly monitoring what's happening there so that we're fully cognizant of what could happen here.
And just as a follow-up, that fall under all things being relative, we still look worse than Wisconsin. So, you said you'd had some conversations with health officials. I was just wondering if you've learned anything from their experience that can inform the response here so far. And any thoughts on why we continue to be worse than they are?
Yep. Hi, this is Commissioner Malcolm. I think, there are some things to remember about Wisconsin, that even as the state restrictions were relaxed, the more significant population centers, the cities, kept restrictions in place. So it wasn't like a complete, all at one time opening for the most part. We have talked with folks from Wisconsin over time. We're actually scheduling another call, might even be today, just to stay in close touch with them. Certainly, we've seen things kind of wax and wane over the course of the epidemic. We started off more slowly than they did. We had a period of faster growth in April and early May. We think, largely attributable to the food processing outbreaks and the spillover effect that had on the metropolitan area. I haven't been tracking what our growth rate looks like compared to theirs just in the recent couple of weeks or days here. Perhaps Chris has, but we definitely are interested in understanding other than some of those, when we've talked before about some of what we see from community to community is, appears to be attributable to super spreader events, which, are to some degree a matter of chance when you get a super spreader and whether that super spreader is in a large gathering. But beyond that, we're really very, very interested in continuing to learn from our peers about what they may have done in a different sequence or different intensity than what we've done. But Chris, anything you'd add?
No, I think as the commissioner said, this is we're in this for the long haul, and at months, Minnesota was ahead of Wisconsin, and now, well, ahead in the sense of fewer cases, and now we are in a different place. But I think that all in all, we'll continue to monitor the situation, and as the commissioner said, we'll be talking with our partners. I think we all want to do what's best for our citizens, and as much as we are in a great competition with Wisconsin on many things, we're not really competing on COVID. We just want to do the right thing. So I think it's important to keep that in mind too.
I'm sorry to monopolize, but a quick fact-checking question. Do you expect the death numbers from today to be affected by any correction tomorrow, or will those be stay as they are?
No, we believe that the mortality figure will not be affected by the testing, that we get that directly from the hospitals.
Thank you.
Next question, we have Bill Werner from Minnesota News Outbreak. Your line is open.
Thank you. Commissioner, this keys off on some of the, I guess you would call it the political climate that is coming out of the special session. Comments from House Minority Leader Kurt Dowd Friday, I believe. He said that the computer model data that the governor is using to make his decisions is off by a factor of at least 10 times. And then he goes on to say, quote, he, referring to the governor, still continues a policy of transferring COVID positive patients into nursing homes, which is literally killing our seniors. I would appreciate if you would respond to that.
Certainly. Well, back to the model question first. I think as we have tried to make clear since the beginning, two things. The model is not built and not intended to be making specific point in time projections. There are broad ranges. Some of the lower ranges of the model are not that far off from what we're seeing now, and the mortality estimates during the month of June are not from the model, are not too far off of what we're actually seeing. But again, if you just look at the kind of the middle of the range single line depiction of the curve, that is the middle of the range, and the entire range around the estimates is quite a bit broader, as I think hopefully we've been clear about that. And the model is one data point among many that the governor looks at. So to say he's making his decisions strictly based on the model is incorrect. And in terms of the allegation that transfers of COVID positive patients into long-term care facilities are causing deaths in the facilities, that is not an accurate statement. As we've explained before, we don't have any cases of spread in long-term care settings that we can trace from an epidemiological perspective to transfers into the facility. And I'll ask Chris to just maybe explain that point a little more.
Sure. We look specifically at this because obviously it's been an issue that's come up quite a bit, both in the media as well as with the legislature. And so if we look at facilities, first when we looked at this, 67% of the facilities had a staff person as their first case. So obviously, if a staff person is the first case, that does not involve a transfer. Then if we looked at those facilities that had residents as their first cases, we also looked then at hospitalizations. The vast majority of the cases where someone was hospitalized who could then be transferred back to the facility, their hospitalization occurred after there were already cases in the facility. And of a situation where we had people who were hospitalized before they had their onset and could have been transferred in all 5 of those unique situations, there was an explanation that did not revolve around that person being a source for the facility. So we looked, we just did this a week or so ago. So this was at a time when we had 866 facilities. We've added a few more since then. But when we looked at 866 facilities, we did not see any situations in which there was evidence of transmission in that manner. So it's something that certainly people are talking about. It's certainly something that we want to be attentive to because it could pose a risk in a situation, but we have not seen that with the data that we have.
Are you considering changing the policy, or might there be some situations under which you would change the policy before you actually get a case that is attributable to a transfer back of a hospitalized person?
Well, we should just emphasize again, this is Commissioner Malcolm, that there are specific criteria that have to be met before a facility can accept a COVID positive patient. They have to be able to isolate patients. They have to have the capacity to have positive patients in single rooms with their own bathroom. They have to have personal protective equipment. And so there's definite detailed requirements from the Centers for Medicare and Medicaid, as well as guidance that MDH has put out since the beginning of the epidemic as to under what conditions a facility can take a COVID positive patient. I think I might have mentioned on one of the calls last week that we've had a CDC team in Minnesota twice now. And the CDC team actually feels quite strongly that, and it may seem counterintuitive on the one hand, but that their point is that facilities that have had positive cases and have learned how to manage them well and have stabilized their situation are probably, and I know this might sound counterintuitive, probably the best place to put a COVID positive patient that needs a place to go. The staff are trained. They've gotten good at providing the necessary care. Many of these people need skilled level care. They can't safely go home or go to a setting without the skilled level of care. So CDC was quite forceful in their belief that these facilities that have had cases and have done a very good job in learning how to manage COVID care should really be applauded for that fact and really represent a degree of competence that's been developed. That's a very good thing for the community.
Thank you both.
Next question, we have Catherine Richards from Minnesota Public Radio. Your line is open.
Hi. Yeah, I'm wondering if you have your contact tracers have traced any cases back to anything that's reopened recently. So restaurants, religious services, or even the protests. Have you seen any direct connection to any of these mass gatherings that have occurred in the last few weeks?
This is Chris Ersman. Thanks for the question. We've been made aware, obviously, of a few cases of positives in individuals who identified that they attended some of the recent mass gatherings, but we have not had, and certainly I want to be clear, there are hot spots, and we are seeing, cases occurring in various communities, but we have not yet had cases where we would say, oh, we've now identified a cluster of cases because of restaurant X or house of worship Y. We have not had that come to our attention at this point.
Okay, and just to follow up on the positivity rate of roughly 3.5% you mentioned earlier, do you have kind of an optimum number in mind that would get you to additional stages of reopening?
Well, this is Commissioner Malcolm. What we've set as kind of a warning indicator is if that positivity rate on a 7-day rolling average were to exceed 15%, then we consider that to be sort of a warning threshold. So being at 3.5 is certainly a good thing. Now, we do collect that data regionally, and it is that test positivity rate is measurably higher in the metropolitan area and in a couple of the other regions of the state that have had significant community levels of disease. So that 3.5% is a total statewide average, certainly heading in the right direction. And I think I do believe the metro area is still above 15%, but is getting closer to that level. May have even dropped below in the last couple of days. We've run that calculation again after we know for sure whether the test counts from yesterday are accurate.
So this sort of optimal rate you'd be looking for statewide before you decided to move to the next.
Well, that was it. Certainly would be one indicator, but no one single measure would lead us to say, well, we're good to go. It's really looking at test positivity rate, but also the rate of case growth. The case doubling measure that we've talked about for quite a while is a less useful measure to us now. At 30,000 cases, we wouldn't expect the doubling rate to be anything close to what it was earlier in the epidemic, but the number of new cases on a population percentage basis is something that CDC and others have looked at and got us into kind of on their list of cities to worry about not too long ago. So we know how quickly that can change. We would also be looking at the rate of community transmission, the rate of growth among healthcare workers in particular, as well as hospital capacity. So it really is kind of how all of those factors are playing together. And if we do see some of those indicators going in the wrong direction, because we still are kind of over the warning threshold in terms of the community spread percentage. It really will look at all that, the confluence of those factors and more before we would say we feel like, at least from a public health perspective, that further reopening would be indicated by these metrics alone. But again, I will just repeat, we fully understand that the public health criteria have to be balanced against other concerns like economic sustainability and so forth.
Okay, thank you.
Next question, we have Austin Erickson from KVRR. Your line is open.
Hello, this is Austin. I talked with Senator Kent Eakin from Twin Valley recently, and I asked him why he voted against Governor Walz keeping his coronavirus emergency powers. He's a DFLer, by the way. And he said that situations are different in greater Minnesota than in the metro area. Fewer cases, such as 1 in Kitson County, 6 in Roseau, 15 in Wilkin. So do you think there should be a one-size-fits-all for the state, or would you suggest, greater Minnesota has different standards than the Twin Cities in reopening?
Well, the approach that we've taken so far has been a statewide approach. Certainly, we are tracking data regionally and don't disagree that the situations are different. However, people move around the state quite a bit, as we know. And so questions would get posed about how you might then, would you combine a regional approach to reopening with travel restrictions between the regions, or how would you manage that? Certainly, I think the governor has mentioned, if things don't keep going in a positive direction and a dialing back is indicated, he might look at more targeted measures to dial back on depending on what's driving the increases. So it will all be quite situational, but with the degree of community spread we have, we have said over and over again that there's a difference between how much disease is probably circulating in the community and how many laboratory confirmed cases one community might have or not. And Chris, would you want to add anything?
No, I agree with your comments related to we are tracking data regionally, and I think your comment about if we did take a regional approach, would we need to limit travel? Because that's a message that we certainly have heard from, our citizens in Greater Minnesota, that they're concerned about, visitors, travelers to overwhelm their healthcare system, and what impact that could have. And I think that if different parts of the state were open at different levels, that would be another factor that would have to be considered. So I think that Representative Eakin makes some good points, and I think that that's why the regional data are being evaluated, and that's why the governor's considering all of that as he thinks about dialing up and also the potential to dial back if that would be needed.
Okay, and then for a follow-up, when I also talked to him, he, when talking about Walz, his vote against Walz keeping his coronavirus powers, he also mentioned he believes that after 30 days, the legislature should have a say in him keeping those powers. Do you think the legislature is having a big enough impact? They're in their communities. They know what's going on in their communities. And some in those communities are saying, somebody in St. Paul or Minneapolis, they might have data, but they don't know what's going on in our communities.
So I think that, the governor has definitely said that even though the law is frankly a little bit unclear on what happens after the first extension of the stay-at-home order, he intends to continue to follow what he thinks the spirit of the law is, and that he will call the legislature back into special session in the future if the current peacetime emergency declaration expires after 30 days and the legislature has adjourned again, then he will call them back. So he fully appreciates their need to have that oversight and that ability to override his declaration of the emergency should both houses vote to do that. So I think that the legislature has, of course, a vital role to play in making sure that there is that balance and that accountability. And certainly the legislature is asking us daily to account for decisions and spending, and they need to. There's a legislative authorizing committee that needs to approve of spending that is done under the appropriations that were made to us earlier. So, indeed, we think that the legislature needs to be involved and is.
All right, thank you.
Next question, we have Tim Nelson from Minnesota Public Radio. Your line is open.
Hi, thanks for taking my call. I'm curious about something you talked about before. Do you have any update on whether child wellness visits are rebounding and vaccinations are rebounding? You were concerned about a drop-off there earlier.
Yeah, just in general, we've been concerned about lots of important health services needing to resume, and that was an important part of the governor's change in the limitations under a prior executive order on services that should be offered, and certainly some of that child care is. We know how important that is for the long term. So, Chris, do you have any update on what we're seeing in utilization?
We are continuing to see our vaccination rates remain below what we would expect to see if we had kind of normal practices. So, yeah, we have seen a reduction in our coverage levels because of folks staying home home, as well as just the overall reluctance that we've seen for people to enter healthcare if they're not ill. So it's a message that still needs to be out. We want parents to know that, you know, it's very important that they continue to make sure their kids are getting evaluated. Those child checkups include many important things, including immunizations. And so it's a message that we need to continue to convey. And I'm reminded for myself that I need to schedule an annual visit and make sure that I get a mammogram. So for all of us at every age, it's important that we're remembering the importance of those preventive care visits, and for kids, all that much more important because they are getting the vaccinations that are the foundation for their immunologic protection. So thanks for bringing that up again.
And one other matter that I was wondering about is that I understand that the alternative care site in Roseville is complete, sort of visiting the greatest hits here, but is that true? And do you have any idea how that's going to be used yet?
This is Commissioner Malcolm. Yeah, I did just hear the same this morning that facility has passed its final inspection, so is ready to be operationalized should it be needed. You know, and there's a good reason why we chose to build out one facility, but not all the others, learning from other states that built out more capacity and ended up not needing it. We know that the first prize is for as much care to be delivered within the hospital setting as possible. So we've really prioritized, and the health systems have really prioritized identifying additional surge capacity spaces that can be converted into ICU level care, and that's the first priority. So the community care sites would only be needed if there wasn't enough capacity to care for both the non-ICU level care and the ICU level care after surge capacity. So we are not at the point of anticipating any patients going into the alternative care site at this point in time at these utilization levels, but it was important to have kind of worked through the processes of standing one up so that we kind of a proof of concept of what it takes to do that. So we feel very good that we've got one such site and the experience of having brought it up to this point.
Thank you.
Next, we have Darren Svensson from KTOE Radio. Your line is open.
Thank you. You noticed, you mentioned some of the numbers that are moving in the right direction regarding the data that is being reported today. We're just over 2 weeks out from the largest gatherings after the tragic death of George Floyd in the Twin Cities. Knowing what the numbers show today and knowing that we're a little over 2 weeks out from those events, can we draw any conclusions from that?
This is Commissioner Malcolm. I'll ask Chris to certainly chime in too, but I think as she mentioned before, in the context of the business sector reopenings and the relaxation of some of the social gatherings that went into place on June 1st, we still think it's a little too early to show the full impact of that. Also, the fact that a lot of the certainly not all, but a fair number of the folks who participated in the mass gatherings tended to be younger, might suggest that they might have less severe symptoms, might be less inclined to seek care, which is another reason why we've been encouraging asymptomatic testing. But certainly I think this next week or two will tell us a lot more. Chris, anything to add?
Yeah, no, I think you're right. What's hard, and even as we anticipate these calls, and I think, we just last talked to you on Friday, and enough days haven't gone by for us to have a very different answer. Unfortunately, you know, it just takes a while. And so, as I said before, we certainly do not want to diminish the positive nature of the fact that we've had fewer cases, fewer deaths. I mean, we want to celebrate every day that those numbers are low, but until we've gotten a little farther out from both the June 1st date and the June 10th date, I think we're reluctant to completely celebrate. That's not to say we're not grateful for every day with positive numbers, but it's just unfortunately not enough time has passed, and it's hard not to be a little bit antsy with that. But that's partly why we are reluctant to declare anything at this point.
But from what I understand, most of the time the symptoms show up within a 2-week period after June 1st. Is it at the end of this week that maybe we can draw some more conclusions? Is it next week? When can we draw some definitive conclusions on whether what took place the final weekend of May and the openings on June 1st are actually affecting things?
Yeah, absolutely. You're right. The incubation period is 14 days. We recognize, however, that if someone would develop symptoms at the end of that time frame, they may not go in to get testing for a day or so, and then it takes a little while for us to get those results. So we're estimating about a 21-day period. So yes, by the end of the week, we should have some ideas based on what happened with all of the mass gatherings related to the George Floyd killing. However, it'll take a little bit longer for obviously the June 1st opening and the June 10th opening.
Thank you.
Next question, we have Dave Ulrich from Pioneer Press. Your line is open.
Thank you. My question also relates to rural areas. I just got back from a week in Hayward, Wisconsin, where you wouldn't know there was a pandemic going on for 2 reasons. One, because nobody is really social distancing up there. And the second is because nobody's sick up there. They have had 8 cases, confirmed cases to date. It's been quite a while since the governor's order in Wisconsin was struck down by their Supreme Court. People have been traveling up there from Chicago, Milwaukee, and the cities for some time, fishing on the lakes and being active. Is it possible that that type of activity doesn't spread this disease very well?
Well, certainly the outdoor activities we believe have certainly a lower risk than indoor activities. That's I think, you know, among the things that are interesting and don't have great explanations yet is why some communities seem to have as different an experience as they do. That I hadn't seen that. And when you say they've only had 8 cases, are you looking at county level data from Wisconsin, or what is?
Yes, that's correct. Sawyer County, Wisconsin had 8, and everyone up there seems to know. People I talked to can pretty much tell you who those 8 people were or their stories behind them. And a number of those cases came very early on, people who have traveled. So it's not like they're not aware of it up there. They're just living in a place with very little of it, and they've seen no evidence yet to change that worldview.
Well, and certainly I think population density plays a role. If you think about the experience in New York City, that was, you know, obviously magnitudes of order greater and worse than what we've experienced here in Minnesota and in our metropolitan areas. And certainly if you're looking at a more rural area, there'll be a different experience. I also think that, you know, it'll be interesting to see, as we have the luxury of looking back, if we find that, you know, there is some level of seasonality to this and we see less this summer and then more in the fall, or if in fact we'll have these waves. So I'm grateful on behalf of the people in that community that they haven't had to experience some of the things that other communities across the country are experiencing. But I do think that I guess I sound like I'm incredibly cautious. I'm not always this cautious in every aspect of my life, but I just think it's best that we recognize that we don't know everything there is to know about COVID after only 6 months, and that, best not to draw really broad, sweeping conclusions based on the experience of one community for 3 weeks, but nonetheless very happy for them that their experience has been relatively positive with COVID.
Right, and then this will be the end of my question. How might that factor in, again, to specifics in terms of how you might look at partial restrictions around the state? In other words, if we have a spike in the later summer in the Twin Cities, right now the approach would be to lock down the whole state again. And I'm wondering if you're thinking, no, you don't need to do that, but no, you also don't need to restrict travel to those areas because the type of travel that's done up there might not spread the disease to rural parts.
Well, I think again, Governor has said he would consider different approaches as circumstances warrant. But again, it's if you've got infected people coming to the community, that is a different issue. There may be less risk of transmission just with the population that's there, and certainly the density of interactions does matter. So there might be less opportunity for transmission, as Chris said, just as a matter of the population density. But it wouldn't be the travel itself that would be less risky. It would really be a question of the specifics of what kinds of interactions people might be having. We still don't recommend large gatherings, even in less densely populated areas, for that reason.
Operator, we have time for one more question.
Thank you. So we have Chris Saris from Star Tribune. The line is open.
I was just following up on the new guidance around window visits and hoping you could explain what brought that guidance about. Also wondering if you could expand on that. I mean, will there be, for instance, outdoor visits that will be brought as well?
Well, I think as Chris mentioned earlier, we are very aware of the negative impacts on persons residing in congregate settings as well as their families in not being able to be together. So we've been looking at and working on ways that might represent low risk and wanting to get that guidance up quickly. Yes, we are looking at outdoor guidance recommendations as well, but Chris also mentioned that I think I mentioned this on Friday as well, trying to engage a kind of a variety of perspectives on the broader question of what kind of protocols and practices might make sense if, as we expect, COVID is going to be with us for a time, and we want to be protective of people who are elderly or who have underlying health conditions, who live in congregate settings. That is a higher level of protection that we think is needed. But how do we strike that very important balance of the other benefits that come from people being able to interact with their loved ones? So it's just a very, very challenging balance to strike, because the more interaction there is, the more risk there is of transmission. There's just no two ways around that. But yet we very much do appreciate the downsides of the current restrictions as well.
And just to add one thing to that, and that is that there are some restrictions that come from CMS, and so we have to consider that for some facilities, they will be obligated to follow federal guidance specifically because of their licensure.
All right, I believe that is all the time we have for this afternoon. I want to thank our speakers and the reporters on the call. I do apologize for the audio difficulty we had at the very beginning. If anybody had a question, either about information that was shared during that time, or if you have any follow-up questions you weren't able to get to during the call, please feel free to reach out to our office. Have a good day, and we will talk again Wednesday.
Keep watching CBSN Minnesota for continuing coverage.
Hi, my name is Jason Ripley, owner of Garage Floor Coatings